All right, everyone, let's dive into something that I think we can all relate to. Chronic low back pain.
Oh, yeah.
It affects so many people. Up to 84% of adults experience it at some point.
Wow, that's a lot.
It is. Thankfully, most cases, they just kind of resolve on their own, but for those who are dealing with subacute or chronic pain, it can be really debilitating.
Yeah, absolutely. Finding the right treatment is important, and it can be a real challenge.
So that's what we are going to be talking about today on this deep dive. If you've tried the more simple remedies and you're looking for something more advanced, well, stick with us.
Yeah, we're going to be focusing specifically on interventional treatments, so things like injections, other procedures, for people who haven't found relief with, those more conservative approaches.
Now, before we jump into the specifics, I think it's important to remember low back pain. It's not, one size fits all.
Right. It's not just one thing. You've got a couple of main categories. You've got non-specific low back pain, and then there's specific low back pain.
Okay. So what's the difference?
Well, non-specific. That's the most common one. And it's when you can't really pinpoint, a specific cause for the pain.
Okay.
And then specific low back pain is, well, that stems from something you can identify. So like a herniated disc or spinal stenosis.
Okay. And I'm guessing since we're talking about interventional treatments, we're mostly dealing with specific low back pain, right?
Yeah, exactly. Because these treatments, they're usually for when we've identified, a very particular problem that's causing the pain. And it's also assuming that, people have tried the conservative stuff first,
Yeah.
like physical therapy, medications, that kind of thing, and it hasn't worked.
Okay. So we're moving into more targeted territory. Now, I noticed that our source material mentions interventional diagnostic procedures. And I'm kind of curious, how do those fit into the picture?
Yeah, that's a great question. It's kind of like detective work,
Okay.
Before you just jump into treatment, sometimes you need a little more information.
Right.
You need more clues to figure out exactly where the pain is coming from. So these procedures, they help us get that information.
So it's like getting a really clear picture before you actually decide how to attack the problem.
Exactly.
Can you give us an example of one of these procedures?
Yeah, so one that's used pretty often is discography.
Okay.
And basically what that involves is injecting a contrast dye, directly into the disc that we think might be the problem.
Okay.
And the idea is that if you inject the disc and it, causes the same pain that the patient usually feels, then you've probably found, the source of the problem.
That makes sense, but is it that straightforward? Are there any catches or, things to watch out for?
Yeah, you're right to be a little cautious there. Discography, it's actually been a little bit controversial.
Oh, really?
Yeah.
Why is that?
Well, for one thing, there's not really a gold standard test to compare it to. So it makes it hard to know how accurate it really is.
Okay.
And then there's also the chance of what we call false positives. So studies have shown that even people who don't have back pain, they can still experience some discomfort when they have this procedure.
So it's not 100%. So if discography isn't, always reliable, are there other options?
Yeah, there are. So one alternative is a procedure called a disco block.
Okay.
And it's similar to discography, but instead of injecting the dye, you're injecting a local anesthetic.
Oh, okay.
And so if the pain goes away, then that's a pretty strong indication that that disc is, in fact, the source of the problem.
Oh, so it's less about provoking pain and more about seeing if we can stop it.
Exactly.
Okay.
More research is definitely needed on this one.
Sure.
But it seems like it could be, a good alternative to discography.
Okay.
But, I think the bottom line is with any diagnostic procedure, whether it's discography, disco block, or something else, you really have to weigh the risks and benefits for each patient.
Makes sense.
Hmm.
Now let's switch gears a little bit and talk about some treatment options. So glucocorticoid injections or steroid injections, those seem to be the go-to for a lot of people, right?
Yeah, they are very common,
Okay.
especially for things like radiculopathy.
Okay. And radiculopathy, just to remind everyone, that's when the pain radiates down the leg.
Exactly.
Okay, great. So can you walk me through how these injections work?
Yeah, so the epidural space is like a cushion that surrounds your spinal cord.
Okay.
And with these injections, we're basically using a needle to deliver steroids directly into that space.
Okay.
The goal is to reduce inflammation, and hopefully that'll lead to pain relief.
So it's basically just calming everything down in there.
Exact.
Okay. Are there any risks with these types of injections?
Well, no medical procedure is completely risk-free,
Right.
right? But generally, they're considered safe. But the FDA did issue a safety communication back in 2014, just kind of highlighting some potential but rare adverse effects.
Oh, okay. What kind of side effects are we talking about?
Well, I mean, they're extremely rare. But there's things like vision loss, stroke, paralysis, even death. But again, super rare.
Okay.
But it's important to be aware of them.
Sure. And it's also important to remember that, like you said, they're very rare.
Yeah, definitely.
Okay. So with these potential risks, when are steroid injections really the best option? Like, what are they most appropriate?
So the strongest evidence we have is for subacute and chronic lumbosacral radiculopathy, that pain that radiates down the leg,
Okay.
usually caused by a herniated disc pressing on a nerve.
Okay. So that's when they really, like, shine.
Yeah.
And what kind of pain relief can people expect from these?
Well, studies have shown that these injections, they can offer short-term pain relief.
Okay.
They can potentially delay surgery,
Hmm.
but they don't seem to provide like long-term benefits.
Okay.
So on average, people experience about a 7.6-point improvement on a pain scale. That's, 0 to 100.
Okay.
And that's at about 2 weeks after the injection.
So that's, I mean, is that a lot? It doesn't sound like, a huge amount.
It's modest, but it can make a big difference for people who are, struggling with daily activities. It might mean they can walk further, sit longer, get better sleep, things like that.
Yeah. So it's about improving quality of life,
Uh-huh.
even if it's not, a complete cure.
Right.
Okay.
And here's the thing. If the first injection doesn't really help, then more probably won't either.
Okay. That's good to know. Now, I remember the source material also mentioned spinal stenosis and nonspecific back pain as possible candidates for these injections. Is the evidence as strong for those?
Unfortunately, no, it's not.
Okay.
It's pretty weak.
All right. So we're really focusing on radiculopathy here
Yeah,
as, like, the best use for these injections.
exactly.
Now, before we move on, are there any other types of injections besides the epidurals that are worth considering for low back pain?
There are a few. Things like intradiscal injections, facet joint blocks, SI joint injections. But for chronic low back pain, they're not generally recommended, just because there's not enough evidence to really support their use.
Okay. So we're sticking with epidurals as the main injection-based approach.
Yeah.
Okay, and I want to circle back to safety one more time. You mentioned some risks. Are there any other concerns with these injections that we should be aware of?
Well, like we said, serious problems are rare, but they can happen.
Right.
Things like a dural puncture, an infection, bleeding, those
Yeah.
are all possibilities.
Yeah.
And each injection, it might slightly increase the risk of a fracture in the vertebrae.
Okay, so it's really important to have that open communication with patients about, what the potential downsides could be.
Yeah, absolutely. Shared decision-making is key.
Okay. Now, let's move on to something else that I thought was interesting in our research. So I came across these terms: intradiscal electrothermal therapy, or IDEIT, and then percutaneous intradiscal radiofrequency thermocoagulation, PIRFT. I mean, those sound like something out of, like, a sci-fi movie.
I know, right?
What are those all about?
Yeah, they sound pretty fancy. So they both use heat to target the nerves within the intervertebral disc. And the goal is obviously to try to reduce the pain.
So they're, like, burning away the pain.
Yeah, basically. But the problem is there's not a whole lot of evidence to show that they're really effective.
Oh, okay.
So they're out there. But we need more research.
Got it. What about radiofrequency denervation? Have you heard of that one?
Yeah, so that also uses radio frequency waves to basically destroy the nerves that are thought to be causing the pain.
Mm.
And depending on, where we think the pain's coming from, that could be nerves in the facet joints, the SI joint, or even the disc itself.
Okay. And does it work?
Well, the research on this one is a little mixed. Some people might get short-term pain relief, but the long-term benefits aren't really clear yet. The studies show that the pain relief is often, pretty minimal. And in the long run, it doesn't seem to work any better than placebo.
Oh, okay. So not a miracle cure.
Not quite.
What about side effects?
They're usually pretty minor, but you could have things like increased pain after the procedure, some
Okay.
numbness, and even like burns at the site where they did the treatment.
Okay. So again, it's about weighing those risks and benefits.
Exactly. Talk to your doctor,
Yeah.
Understand what the potential outcomes could be.
Right. Now, while we're on the topic of these kind of less conventional treatments, I saw that our source material also mentions prolotherapy and botulinum toxin injections.
Oh, yeah.
Are those worth considering for chronic low back pain?
let's start with prolotherapy.
Okay.
So basically, they inject irritants into the ligaments. And the idea is that that will trigger inflammation, and eventually that'll actually make the ligaments stronger.
So it's like fighting fire with fire.
Yeah, you could say that. But the evidence is pretty weak for this one. And it often actually makes the pain worse, at least temporarily.
Ouch.
Yeah. So not necessarily the most comfortable option.
No. What about botulinum toxin? Isn't that like the Botox stuff?
Yeah, that's right. It's most famous for, reducing wrinkles.
Right.
But researchers have been looking at it for chronic low back pain, too.
Interesting. How does it work for pain?
Well, it blocks nerve signals, which prevents muscles from contracting.
Okay.
And the theory is that if you relax the muscles, then the pain will also decrease.
So it's about releasing all that tension.
Right. But the research is still pretty limited. There was one small trial that showed it could help with pain in the short term. But, we need more research to know for sure.
Okay. So that's a maybe.
Yeah, we'll have to see what the future holds.
Now, I also want to talk about etanercept. I saw that mentioned in our source material.
Yeah.
And it sounds like it could be a potential alternative to glucocorticoids.
Yeah, potentially. So etanercept, it's a biologic medication,
Oh, yeah.
and it's in a class called TNF-alpha inhibitors.
And remind me again, what's TNF-alpha?
So TNF-alpha, you can think of it as like, the master controller of inflammation.
Oh, well.
It's a molecule that basically ramps up the inflammatory response.
Got it.
And that contributes to pain and, other symptoms. So TNF-alpha inhibitors, they work by blocking that molecule.
Okay.
So it's kind of like putting the brakes on inflammation.
So instead of using steroids to just like calm things down, it's actually targeting like the root cause of the inflammation.
Right. And because this molecule is involved in both, radiculopathy and discogenic pain,
Okay.
that's pain that comes from the disc itself.
All right.
There's been some interest in using etanercept to treat those conditions.
That makes sense. Does it work?
Well, the studies so far haven't been super clear-cut. Some of them haven't shown any real benefit compared to a placebo. But other studies have suggested that it might help, especially at lower doses and over a longer period.
So it's not like a definite yes, but there's some potential there.
Yeah. We definitely need more research to know for sure.
Okay. Sounds like we're still in the early stages with this one.
Yeah, definitely. But it's something to keep an eye on.
For sure. And I think this just highlights how important it is to stay up to date on the latest research and all the advancements in pain management.
Oh, absolutely. This field is constantly changing. There's new discoveries happening all the time.
It's really exciting.
It is. It really is. It's amazing to see how much progress is being made.
Yeah, for sure. Okay, so we've talked about steroid injections, these nerve-burning techniques, prolotherapy, even Botox. I mean, are there any other interventional treatments out there that we should talk about?
Yeah, there are a couple more. Have you heard of spinal cord stimulation?
Spinal cord stimulation. And that sounds kind of intense.
I know, it sounds a little sci-fi. But it's actually a pretty well-established treatment for chronic pain, including back pain.
Oh. Okay.
So basically, they implant this tiny device, kind of like a pacemaker, under your skin, and it sends these like mild electrical pulses to the spinal cord, and it kind of interrupts the pain signals before they can get to the brain.
So it's like a volume knob for pain.
Yeah, that's a great way to put it.
Okay.
And for some people, I mean, it can really be life-changing.
Wow.
Studies have shown it can significantly reduce pain, improve function, and people might even be able to take fewer opioids.
That's incredible. But I imagine, a procedure like that, there's got to be some things to consider, right?
Right, of course. It is a more invasive procedure than, just an injection.
Sure.
So it's usually for people who haven't had success with other treatments.
Okay.
And like any surgery, there are potential risks, infection, bleeding, problems with the device itself.
Right.
But for the right patient, it can be really valuable.
Yeah, that's amazing. It's like really cool how technology is being used to like address pain these days. Speaking of technology, what about those implantable pumps?
Oh, yeah, those.
Do those have a role in chronic back pain?
Yeah, so you're probably thinking of intrathecal drug delivery systems.
Okay.
So basically, they implant a pump under your skin, usually in the abdomen, and it delivers medication directly to the spinal cord.
So it's like a direct line to the source of the pain.
Yeah, exactly.
Okay.
And because it's so targeted, you can use lower doses of the medication.
Oh, okay.
Which hopefully means fewer side effects.
That's good. What kind of medications do they use in these pumps?
The most common one is baclofen.
Okay.
It's a muscle relaxant, so it can be really helpful for spasticity, muscle spasms, which, can be a big part of back pain.
Right, right.
They might also use things like opioids or ziconotide.
Okay.
That's a non-opioid pain reliever.
So it's not just about managing the pain, but it's also about, like, improving mobility and function.
Exactly. If you can address those muscle spasms, the stiffness, people can move more freely, more comfortably.
Yeah, for sure. But, it sounds like a pretty powerful treatment. Are there any downsides?
Of course, yeah. Like with spinal cord stimulation, it is a surgery.
Right.
So there are those inherent risks, infection, bleeding, that kind of thing.
Right.
And then there's also the risk of problems with the pump itself,
Okay.
infection, malfunction. And then the medications themselves can also have side effects.
Right.
Some are just annoying, like drowsiness, but others can be more serious depending on the drug.
Okay. So it's really, again, about weighing those risks and benefits, making sure it's the right choice for the individual patient.
Yeah, definitely.
It's really amazing to me, like, how many different treatment options there are for chronic back pain.
It is.
But I imagine with all these choices, it can be kind of overwhelming for patients and even for doctors, trying to figure out what's the best approach.
Yeah, absolutely. That's why it's so important to really personalize the treatment plan. There's no one-size-fits-all solution.
Right.
The best strategy is going to depend on the individual patient, their type of pain, their overall health, their preferences. It's a lot to consider.
It really sounds like shared decision-making is, like, so crucial in this context.
Oh, absolutely. Patients need to be active participants in their care. They need to understand the potential benefits and risks of each option,
Right.
and then work with their doctor to choose what aligns with their goals and values.
Yeah, I love that. Okay. So before we wrap up, I want to touch on something you mentioned earlier, the role of opioids in chronic back pain management.
Yeah.
It's definitely a topic that's, been surrounded by controversy, concern, especially in recent years. So can you kind of shed some light on where things stand with opioid use for chronic back pain?
Sure. It's definitely a complex issue. Opioids like morphine, oxycodone, they've been used for decades to treat pain, including back pain.
Right.
And they can be effective for short-term pain relief, after surgery or a serious injury.
Right, right.
But when they're used long-term for chronic pain, the risks can outweigh the benefits.
Yeah. What are some of the major concerns with long-term opioid use?
Well, there's the risk of dependence and addiction,
Right.
even when they're taken exactly as prescribed.
Wow.
And then tolerance can also develop, meaning people need higher and higher doses to get the same pain relief.
Okay.
And then there's a whole slew of potential side effects: constipation, nausea, drowsiness, even respiratory depression, which can be life-threatening.
Wow. Okay. It's a reminder that even medications that can be helpful, in certain situations, they can have serious downsides if they're not used properly.
Yeah, absolutely.
So where do opioids fit into the current recommendations for chronic back pain?
So generally, the consensus is that they should be reserved as a last resort,
Okay.
only after other treatments have been tried,
Yeah.
and only when the benefits clearly outweigh the risks. And even then, they should be used at the lowest effective dose for the shortest possible time.
Okay. So it's all about using them very carefully with a lot of caution.
Exactly. And it's super important to have those ongoing conversations with patients about the risks, the benefits, and the alternatives.
Yeah, communication is key. So it sounds like there's kind of a shift happening in the medical community, moving away from just relying on medications to manage pain and focusing more on these, like, multidisciplinary approaches.
Yeah, definitely. We're seeing a real shift in how we think about pain management. It's not just about masking the pain anymore. It's about addressing the root cause, improving overall function, quality of life. And that often involves a combination of treatments: physical therapy, psychological therapy, lifestyle changes, and yeah, in some cases, these interventional procedures we've been talking about.
So it's about looking at pain holistically, taking this more comprehensive approach.
Exactly. Treating the whole person, not just the symptom.
I love that. And, it brings us back to the importance of personalized care, shared decision-making.
Right.
Every patient is different,
Right.
and their pain experience is different.
Right.
So the best treatment plan has to be tailored to their specific needs.
Absolutely. Empowering patients to be active in their care,
Yeah.
working together with their healthcare team to find what works best for them. That's the goal.
I love that.
Hmm.
Partnership and collaboration. Now, before we get to our final thoughts, is there anything else about interventional treatments for chronic back pain that we should mention?
I think I've covered a lot.
Huh.
From diagnostics to all the different treatment options.
Right.
But I do think it's important to remember that these treatments, they're not a quick fix. They're part of a bigger pain management strategy, and it often involves ongoing care adjustments along the way.
That's a good point. It's not about finding a magic bullet. It's about finding a sustainable approach,
Mm.
something that helps people manage their pain and live their lives.
Exactly. Finding what works best for each person, supporting them on their journey to better health and well-being.
I love that. Okay, so as we wrap up this deep dive into interventional treatments for chronic low back pain, I have to say, I feel pretty hopeful,
Yeah.
It can be a really tough condition, but there are so many options out there, and the field is always evolving.
Yeah, absolutely. New research, new innovations are coming out all the time, offering new hope for people with chronic pain. It's exciting.
Yeah, it is exciting. It's good to know that, progress is being made.
Right.
Speaking of progress, I'm always curious about what the future holds for treating this, chronic back pain.
Mm-hmm.
Are there any like exciting developments that you're like really interested in on the horizon?
Yeah, actually, there are several. One that's getting a lot of attention is stem cells.
Stem cells for back pain.
Yeah.
Yes. Okay.
So the idea is you'd use the regenerative power of stem cells to, actually repair the damaged tissue in the spine,
Wow.
like discs or cartilage.
That sounds amazing. Like almost too good to be true. Using our own cells to heal. Like, is there any evidence to support that?
Yeah, it is still early, but the research so far is pretty promising.
Okay.
Some studies have shown that, if you inject stem cells into a damaged disc, it can reduce pain, improve how well people can move, and it might even help regenerate some of that lost disc tissue.
Wow, that's incredible. So if those results, hold up in bigger trials,
Hmm.
it could really change how we treat back pain,
Yeah, it could be a game changer.
especially for things like degenerative disc disease.
Right,
Yeah.
exactly. Another area that's looking promising is personalized medicine.
Okay, personalized medicine.
Hmm.
So that's like using genetic testing and
Yeah.
stuff like that to basically create a treatment plan that's specifically for that patient.
Yeah, exactly. So moving away from that, one-size-fits-all approach.
Right.
For example, you could use genetic testing to figure out how a patient metabolizes certain pain medications. Some people process drugs differently than others.
Right.
And that information could help you choose the best medication and the right dose for that specific person, and hopefully reduce side effects.
Yeah. It's amazing to think that, individualized treatment could be like the norm one day. Are there any other like futuristic technologies that you're, keeping an eye on?
Yeah, so there are some big advancements happening in neuromodulation techniques.
Okay, neuromodulation.
And basically what that means is they're using technology to kind of change the activity of the nervous system to reduce pain.
So like rewiring those pain signals.
Yeah, exactly. One example is dorsal root ganglion stimulation.
Okay.
It's a mouthful. But basically, they implant a little device near this cluster of nerves called the dorsal root ganglion.
Yeah.
And that area plays a big role in sending pain signals. So the device sends electrical pulses to those nerves, and it basically blocks the pain pathway.
So it's like spinal cord stimulation, but even more targeted.
Exactly. More focused. And the hope is that you can get better pain control with fewer side effects. It's still pretty new, but the early studies are looking good.
Wow, that's really interesting. I mean, it's amazing to think about all the possibilities for pain management in the future. But, like with any new technology, I imagine there are like some ethical questions that come up, things we have to consider.
Oh, for sure. As this stuff gets more advanced, we have to be really thoughtful about the ethics, make sure it's being used responsibly, that it's accessible to everyone.
Right, right. Progress shouldn't come at the cost of our values.
Exactly.
Well, I think it's safe to say that we've only just scratched the surface of this whole world of interventional treatments for chronic back pain. I mean, it's complex.
Oh, it is, and that's what makes it so interesting. There's always more to learn. New ways to try to help people who are living with this pain.
It's been a really great deep dive. I think we both learned a lot,
Yeah, me too.
and hopefully our listeners have too. So, to everyone listening, we encourage you to keep, learning about this topic. Ask questions. Talk to your doctor. Be involved in your own care.
Yeah. And remember, there's always hope. New research is happening all the time. We're learning more every day.
That's a great message to end on. Until next time, keep diving deep, keep those brains buzzing, and keep the conversation going.